rehabilitation, post-op care, I guess you would say. And we've talked some about that. So would you like to discuss that and how that affects what you do?
That's really, I have to tell you, crucially important. And we were talking about this in the office just the other day. When I used to do hand surgery, I used to put fingers back on. There was a day that I used to do that, and I was trained by the best guys in the world and all that. So I just would emulate what they would do. What would Dr. Bunky do? So we did that, and you can be the best hand surgeon in the world. I am not. There are some guys that are phenomenal, but basically you can be the best hand surgeon in the world. But if the patient doesn't do the physical rehab, the occupational therapy, it's not going to work. Right. So you can go ahead and try to set the stage for recovery best you can, but it really is a team effort between the patient and the patient's caregiver in some regards,
sure.
And then also us at the office. And then when the rubber hits the road, when you actually make the incision and do the operation, et cetera, et cetera. So it's all of that combined to try to put people in their best spot. And I tell people all the time in the office, I do primarily aesthetic plastic surgery, and the real key for that is setting up their universe so that they would heal well. And we have the luxury of time. It's not a gunshot wound. It's not a cancer operation that you got to move fast on.
And it's elective surgery. And
it's elective surgery. It's got to be safe and effective. And by that, if there is an opportunity for folks, can I get my mother who lives out of town to come and help me? Oh, geez, I got to, put the kids over at grandma's house for 3 or 4 days. You can go ahead and set up your universe so as to best help yourself. People don't realize that lots of these surgeries, they do it on Friday. They think they're back at work on Monday. That's not true. And the body will heal the way the body wants to heal. And I tell most everybody this is a year project we get ourselves into, whether it's breast aug, whether it's facelift, whether it's rhinoplasty. There's certain stages of healing. And for example, typically scars look their most red and most raised at about 4 months. And I tell them usually they look better about 10 months to 12 months.
Right. Because that's the thing, because it's people think like I get the plastic surgery done, the procedure done, and then within a couple of weeks or a couple of months, I'm going to be great. It's like it's a long process.
It's a process
for the healing,
right? And that's just when we hear from dinosaur age, right? You go ahead and you're running after Tyrannosaurus Rex and you twist your ankle and your ankle swells up. Well, we've carried those genes forward. Nowadays, we put ice on it and elevate it, and we actually, if there's a fracture, we can operate on it. But still, there's trauma, there's swelling, and for example. My folks that get tummy tucks, abdominoplasty, they'll get on the scale. I don't know why they do this, but they get on the scale about 3 days later, and they're up 5 or 10 pounds, and they're upset. And they say, "Wait a minute, you did 5 liters of liposuction, and you got the big tummy tuck, and blah, blah, blah." And the answer is yeah, you're holding on to water, and they can't get their rings on their fingers, etc. And I tell most of the running joke in our office is we tell the husbands and boyfriends to take the scale and hide it in the garage for about a month. And even with the liposuction, we have, a stage 1 compression garment, and usually we switch them out at about 3 to 4 weeks. And people on day 3 are like, oh my God, this is so tight. And again, usually about 4 weeks, are like, oh my gosh, this is loosey-goosey. So then we get a second one on it, which is even tighter. So there are processes that go. Breast augs, for example, you put them in, everybody looks great on the table. They wake up and they go, way up by their clavicles. They usually stay there for about a month, and then they start moving down at about a month. And one will go faster than the other one. So there'll be one good kid and one not so good kid. That's how that works. But at the end of the day, meaning 10 months to a year, usually everything falls into place where it's supposed to be, et cetera, et cetera. And so we at the office, we try to educate folks best we can. And we try to do that office visit with the website and this podcast, et cetera, et cetera. And then also my staff in the office are terrific educators too. And we do verbally, and we write it out, and we have cartoons on the website. So we really try to make it the best we can.